What is your osteoporosis fracture risk assessment score? Have you ever wondered how likely you are to experience a fracture due to osteoporosis? Your osteoporosis fracture risk assessment score is a helpful tool that estimates this likelihood over the next 10 years. The most commonly used method for calculating this score is the fracture risk assessment tool, often referred to as FRAX. This tool provides a percentage that reflects your 10-year probability of experiencing a major osteoporotic fracture, which includes fractures of the spine, hip, forearm, or shoulder, as well as specifically assessing your hip fracture risk. The FRAX score takes into account several clinical risk factors and can also include your bone mineral density, which is measured during a bone density test. This test typically focuses on the femoral neck area of your hip. Understanding your score can help your healthcare provider determine if you need treatment or lifestyle changes to reduce your fracture risk. Some of the key factors that contribute to your FRAX score include your age, sex, weight, and height, which helps calculate your body mass index. Your history of prior fractures and family history of hip fractures are also important. Other factors include your smoking status, whether you are currently using glucocorticoid steroids, and if you have rheumatoid arthritis. Additionally, any secondary causes of osteoporosis, such as hyperparathyroidism or Cushing's disease, as well as your alcohol consumption, can influence your score. If you have had a bone density test, the T-score from that test will also be factored in. To get your FRAX score, your healthcare provider will gather this information and may suggest a bone density test if you show risk factors or signs of bone thinning. The FRAX tool will then give you two percentages, one for your 10-year risk of a major osteoporotic fracture and another specifically for your hip fracture risk. Interpreting the FRAX score is straightforward. A 10-year risk of a major osteoporotic fracture below 20%, along with a hip fracture risk below 3%, is considered low risk. If your hip fracture risk is 3% or higher, or if your major fracture risk is 20% or higher, it indicates an increased risk. In such cases, your doctor may recommend treatments to strengthen your bones and prevent fractures. Scores that fall in between may require further evaluation or lifestyle changes. The FRAX score is particularly beneficial for individuals with osteopenia, which is low bone density that does not yet meet the criteria for osteoporosis. It helps determine if treatment is needed beyond just the results of a bone density test. While FRAX is widely used, there are other fracture risk calculators available, such as the one from the Garvan Institute. This tool also considers factors like age, bone density, body weight, prior fractures, and history of falls. However, FRAX remains the most recognized and endorsed tool globally. It is crucial to remember that these fracture risk assessment tools provide estimates rather than certainties. They should be interpreted by healthcare professionals who can consider your overall health. These assessments guide decisions about managing osteoporosis, including lifestyle changes, fall prevention strategies, and medication options. Regular screening is recommended, especially for postmenopausal women and men over 50 who have risk factors. This helps monitor bone health and fracture risk effectively. In summary, your osteoporosis fracture risk assessment score, typically calculated using the FRAX tool, combines clinical risk factors and bone density to estimate your 10-year fracture risk and guide treatment decisions to reduce the chance of fractures.